one of the things that we here as policymakers, we expect Dan and the Senator and others in the House and Senate here, is that I once said and got roundly criticized for saying, I said, you know, when I was talking to the Chamber of Commerce, to the business people, and they said, well, you're spending a lot of money. And I said, you know, just like you all have to spend money to make money, you got to lay down a foundation. You got to spend some money in order to save hundreds of billions of dollars over time. And so, and that covers spending the money to get the electronic record keeping going, because ultimately it will save billions of dollars, and getting standardization, which will save billions of dollars over time, in addition to delivering better health care. Talk to us, Doc, about what your institute has come up with, and I found, at least maybe because I had asthma, because I found it particularly interesting, your study with relation to asthma around here. Can you talk to us about that?
Yeah, I'd be honored to do that. Thank you. I just, if I could, like us to take a little step back with a slightly broader perspective in thinking about health disparities. And I can just give a few statistics. I don't want to spend too much time doing that. But for example, every year in Chicago, 12,000 black people die on average. And if black people had the same death rate that white people did, 4,000 fewer would die. That means simply because black people don't have the same death rates, an extra 4,000 black people a year die. If you do the arithmetic, that's 10 a day. So every day, including today, 10 black people are dying in Chicago for no reason other than lack of insurance, poverty, and other social conditions like that. And when we look at those social disparities throughout the city, they're just overwhelming and literally a matter of life and death. And that's why when I see on television people yelling and screaming over what we know are ideological issues, not substantive issues, it just hurts me, because I think what they're doing is giving up any hope of ever bringing health to all of our citizens. You know, it's interesting, when Martin Luther King came to Chicago to fight against housing discrimination, he lived right here in North Lawndale. And right down the street, we could walk there. And Dr. King said at one point, of all the forms of injustice in health is the worst kind. And certainly Dr. King knew a lot of forms of injustice, and so for him to single that out, I think is really significant. And so, along with what Alan Channing said at the beginning, what we at Sinai are trying to do is bring health equity, good health, to all of the people of Chicago, of the communities that we serve. One area that, by the way, and I know your family is particularly interested, as was the Vice President, is we found a huge disparity in breast cancer mortality, again, between black and white women. So in 1980, white women and black women were dying at the same rates from breast cancer. But now in 2005, the death rate for black women is twice as high as it is for white women. And I know your family has an initiative around breast cancer, and boy, it couldn't be better. We have a guest here, Mark Hurlbert, in the room. Mark, could you stand up, Dr. Hurlbert, just for a second, please? Dr. Hurlbert is the scientific director of the Avon Breast Cancer Foundation, and they've been working over the years to form public-private partnerships and have contributed over $600 million to the breast health of people. We've been working around that issue of breast cancer in North Lawndale and in other associated communities, trying to go out and, again, like Alan Channing said, to do pre-primary care issues. And then finally, with respect to the asthma situation, we found any number of children in pediatric asthma coming to our emergency room with episodes of asthma, being hospitalized, missing days of school, waking up in the middle of the night. The families all have to come into the emergency room. They bring the children. The next day, the children miss school, the parents miss work, and on and on and on like that. So we have formed the Pediatric Asthma Initiative here at Mount Sinai. And what we've been doing is, again, trying to go out with the families in their homes, help them clean up their homes, help them get rid of asthma triggers, patch up holes in the walls where rodents are coming in, eliminate the problem of roaches, convincing families not to smoke, and if they can't give up smoking, at least not to smoke near the children so they're not exposed to secondhand smoke, which is a common phenomenon. I think one outstanding attribute of the program is that we hire people from the community. to become these community health workers, to go into the homes. Often they're people who haven't had jobs before. And so we're giving them jobs, we're giving them health benefits, and doing many other community strengthening work with them. The remarkable thing for me is that I'm a mathematician, not a physician like most of you all, and we carefully evaluate what we do. And what we found is that these kinds of programs, and we're now in the 8th year of these programs, is that we've been able to reduce by 75% hospitalizations, by 70% emergency room appearances. We've been able to decrease utilization of urgent visits to the doctor, but at the same time increase regular visits to the doctor. So the whole system is becoming more rational. The children are missing fewer days of school, the parents are missing fewer days of work, and it's just terrific. And as you alluded, Mr. Vice President, I just have one short paragraph I'd like to read it, and then I promise I'll stop. Unless, of course, you'd like me to go on for another half hour.
Actually, I kind of would.
Well, I'll just say this one last quote. And this is from a document we've written. It's on our website at suichicago.org if anyone wants to look at that. But we say about our pediatric asthma program, when the costs of the project are figured out, the potential cost savings associated with the intervention are remarkable. For example, we estimate that the intervention is associated with cost savings of $2,561 per participant per year. $2,561 per participant per year. Given that a full-time community health worker can effectively serve approximately 100 patients a year, we would therefore expect that by funding one community health worker, the Illinois Department of Public Health could save approximately $256,000 a year, one of them. Given that the department spends $300 million on asthma hospitalizations alone in Illinois, the cost savings would be huge. And so when we see people, screaming and yelling about the expenses and protesting mindlessly, I think, that this plan is going to be expensive, no one is thinking about what the outcomes are going to be. What benefits are we going to reap from this kind of prevention? How can we help the people not only not be as sick, but become healthier participants, healthier citizens in the truest sense of the word, not to mention how can we help people save money? It seems to me that, on the other hand, there is no funding in any regular healthcare provision for community health workers. The way we have this is we've been fortunate to receive a grant. Actually, we got it from CDC, from the Centers for Disease Control. Thank you very much. But wouldn't it be, just imagine the sensibility of it all, of providing community health workers to these programs. I mean, what we said, and really this is a conservative estimate, one community health worker could save $250,000, $250,000 on asthma alone. And if you hire several of them, well, you could just keep multiplying that out. And it decreases emergency room use, helps the children go to school, helps the parents go to work, and just, I think generates in the truest sense of the meaning a healthier community. I do hope that, we'll be able to build and create, and I know you all are trying as hard as you can, but a comprehensive healthcare system that will deliver these benefits for all. And although no one is asking me, it seems to me that a notion of Medicare for all would carry the flow.